A concussion can happen anywhere. Individuals can get injured in their own home or their apartment. Also, we get individuals that sustain concussions on a sports field, whether it's a football field, soccer field, any sort of sports terrain.
I was driving straight through a green light and somebody turned left before I was through the intersection.
The boom swung across the boat while we were going straight downwind, and it hit me in the mouth. It knocked me out of the boat into the water.
I didn't black out. I actually thought I was pretty fine. I was surprised that nothing had happened, but I kind of checked myself and was like, I'm not bruised, I'm not bleeding, and I can stand up.
I didn't know it was a concussion. They brought me to the hospital and they asked me a few questions. They gave me an MRI and they said I was fine and they sent me home.
I didn't experience symptoms of the concussion until a week later. Actually, didn't even hit my head.
I didn't feel too great the next day. So that's when I called the health center and I made an appointment, and they diagnosed me with a moderate concussion pretty soon after.
A concussion is an injury to the brain that results in an energy deficiency from what your brain requires and what's being provided to it in order to heal. The concussion itself is not usually an emergency. It's when you worry about other sort of injuries to your brain in which it becomes an emergency. The few symptoms that we think about are people that have an extended loss of consciousness beyond 30 seconds, if people start to feel numbness, tingling, weakness in a certain extremity. Those are all signs and symptoms that are concerning for an emergency that needs to be evaluated immediately. There's a large range of severity that we see at the initial visit in terms of the types of symptoms that the students and patients are reporting. But unfortunately, all of those symptoms at the initial visit do not always correlate with the duration of their symptoms.
I kind of dismissed some of the shakiness or balance issues or feelings of fogginess as just part of what happens after an accident.
I was feeling really tired, and it was kind of a different sort of pain in my head than a normal headache.
And I was having trouble concentrating. I was getting headaches and was having a lot of eye strain issues.
Other symptoms are actually more related to emotional status, feeling more angry, feeling more irritable, or feeling more sad than they usually do.
So you shouldn't be embarrassed, or you shouldn't be hesitant to communicate with the administration, your dean's office, with your faculty, keep them abreast of what's going on so that you can make up the work you're missing and have as little disruption to your performance as possible.
Every initial visit here, we make sure that all students sign a release of information form. We recommend that they email their professors and speak directly with their deans about their diagnosis.
I was out of class for a couple days and I missed some midterms. I took makeup exams a couple weeks later when I was feeling better, which is kind of a tough thing to do.
You know, the primary concern is your health. Taking care of yourself and following the recommendations for treatment are going to be the best way to not disrupt, or disrupt at least as little as possible your progress.
Within the first 2 to 3 days of a head injury, we recommend that students only take Tylenol for pain. Anything like an aspirin or an ibuprofen can theoretically increase a patient's risk of a bleed within their brain.
I was instructed to avoid screens and bright lights and loud music.
Even looking at things, using your eyes and your brain trying to figure out what it is you're seeing, that is work on the brain.
I discovered that if I ignored those instructions, I did feel pain, so that it was good advice.
So it's sort of like you break an arm. I've broken an arm, I've broken a foot. You have to immobilize it. But there's no way to immobilize the brain. The only way to do that is to use it as little as possible.
No physical activity for a couple weeks even after the concussion, so I was out of practice for a couple weeks.
Once we have evaluated you and think that you are ready to return back to activities, we make sure that all patients return back in a stepwise progression to their full level of sports activity. This way we can make sure that you're able to tolerate an increase in your heart rate without getting a return in your symptoms.
Our students oftentimes take pride in their ability to persevere in the face of challenges. But in this particular case, persevering without taking care of yourself is only going to make it more detrimental to your performance and increase the risk of this injury really having a cascading effect on your ability to finish the quarter.
And I think that that's an important thing to know, is that like there's not all that much that can be done for a concussion, that like can tell you to rest and to sleep as much as you possibly can and to be sensitive to your symptoms and try not to aggravate them.
But I think it's really important to step back and to take care of yourself and recognize that that's really the best way you can show your courage and persistence.
I feel great now. It's not worth it just to wait it out, because you can come to NUHS and get checked out pretty quickly, and they will make sure that you are back doing whatever you want to be doing as soon as possible.